We've touched on it in some of your comments, but let's explore it a little further. The Affordable Care Act, it's an important issue. It keeps coming up. It has withstood dozens of challenges in Congress. It's withstood scrutiny by the Supreme Court, and it currently is the law of the land. Is it a settled issue, or in your opinion, where do we go from here? Congressman Nolan?
Well, there's never a final score in politics, so I suspect it's not a settled issue. But I do like the good things that it has done. I have, in fact, probably some of our same friends here, one with Parkinson's disease and another young couple with a child with a brain tumor who were thrilled with the Affordable Care Act because they were protected from bankruptcy and they were able to get affordable insurance to provide for their family. Those are just a couple of the things that the Affordable Care Act has done that I think are most important. Now, is it the final thing? No, I've introduced a number of amendments to make some changes to it, to make it better. And yes, I do support single payer, which is exactly what Medicare is. You know, they administer the Medicare program in this country for about 3 or 4%. The private sector insurance programs administer for about 27%. And that's why, you know, practically a third of all the healthcare dollars that we spend go into administrative costs and profits for big insurance companies. We need to find a way to get universal health care that's affordable for everyone in America. There's still 40 million people that don't have insurance in America. This problem is not fixed yet. This thing is not over with. There's still a great deal more that we need to do to make sure a number of things. One is make sure everybody pays. You know, that's kind of a conservative notion, but I embrace that. Make sure that everybody's paying the same rate because that's the fair way to do it. And make sure that everybody's got the fundamental basic coverage. That's what Medicare attempts to do, does a pretty darn good job, and that's what I propose for the American public. Other nations in this world of ours do it, and guess what? They provide health care for lower costs than what we do, and they get better results in terms of life expectancy, infant mortality, and all the rest. We can do better, and I'm committed to it. Thank you.
Thank you. Mr. Mills, the Affordable Care Act?
Well, first of all, what cannot continue will not continue. And as what we've seen from the Affordable Care Act so far is that costs have gone up and access has gone down. We have people that are paying higher premiums, higher copays, higher deductibles. They're getting less for it. Remember the promises. If you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. And everybody's going to save $2,500. Well, that's a lie because it's a bad plan. And it will not work. I am for healthcare reform. Healthcare reform that actually brings down costs and increase access. And I'm also for the goals of the Affordable Care Act, which is making sure that people don't have to worry about pre-existing conditions, lifetime maximums, or if they have a catastrophic health condition, that they don't have to worry about where the care is coming from. However, we have to decide who we are as a people, who we are as a society. Are we a society of social safety nets and legal protections, or are we a welfare state with a government big enough to give us everything, but also big enough to take it away? So we need to strengthen social safety nets such as MSHA, Minnesota Comprehensive Health Association, which due to Obamacare is going to be closing at the end of this year. So we could have looked at that high-risk pool. Was it perfect? No. But could we have made it better? Yes. We could have worked on our social safety nets and legal protections as HIPAA, and then let the free market bring the medical economy, the inflation rate of the medical economy, in line with the inflation rate with the rest of the economy. Because we know the free market works, and we know that socialism does not work. So buying and selling insurance across state lines, tort reform, price transparency in the medical economy, and also more utilization of health savings accounts to put the power in the hands of the patient and the consumer. So it shouldn't be between the patient, the government, the insurance company, and the doctor. It should be between the patient and the doctor. We have to get back to what we stand as Americans.
Thank you. Mr. Sandman, your thoughts on the Affordable Care Act?
And that's just it, affordable. I'm in for everybody does need insurance, single payer. But the program that is out there right now does not make it affordable to anyone who is single, maybe living on welfare, maybe having a minimum wage jobs, working at McDonald's. It's not affordable. I don't say we scrap the whole plan, but we definitely take it off the table and we fix the thing. If other countries in the world can do this, why not us? We are driven so much by profit and greed by the corporations, insurance companies, they forget about their people. And that's us. So it needs to be looked at, analyzed, scrutinized, and make it affordable, darn it. Affordable. Thank you.
Thank you. Congressman, rebuttal, if you will.
Well, you know, Mr. Mills now is saying he supports many of the things that are in the Affordable Care Act, but somehow you want to repeal it. Talk about doublespeak. It's starting to, you know, smell like the barn on a warm Sunday afternoon here. The fact is, you know, you keep talking about free market, you keep talking about affordable. Why do you think we had to abandon the free market and establish Medicare? Because people couldn't afford it. That's why. And why do you think we need some changes now? Well, first of all, we got to rebuild the middle class. They can't afford anything with the minimum wages, and you oppose an increase in their minimum wages? And you find it personally offensive that the super rich millionaires and billionaires should have to pay more taxes? You know, I quite frankly find it a little personally offensive that you would want to deny a working men and women in this country a living wage. Because then they might be able to afford some health care regardless of whether it was in the private sector or the public sector. But let's not throw these slogans around about socialism and government control and taking over. We're looking for some common sense solutions here to get affordable health care to everybody in America. It's a fundamental right where I come from, and we need to rebuild this middle class so people have some income to afford a lot of things, like a home, and to afford to feed their children without having to work 2 or 3 jobs. That's what this contest is all about.
Thank you.
That's what this choice is all about. It's a question of who you're for.
Thank you, Congressman. Mr. Mills, I suspect you have a response?
Yeah, how much time? He covered a lot of ground there. First of all, you know, I've always been, he says that it's smelling like the barn, I believe. How I've talked about how I would handle health care reform, I've always been consistent. And again, you know, if that's your accusation, substantiate it without editing my words together out of context. As far as the minimum wage is concerned, those jobs are stepping stone jobs. They're designed for 16 and 17-year-olds to get their first job, to get the skills and the experience they need to get the next paying job that they have. The fact that there aren't jobs after those is a stunning indictment of the failure of the Democrats that have been in control of this economy for the last 6 years. We shouldn't be removing those stepping stones. We should be reigniting our economy because, you know, in the Bakken oil fields, nobody's talking about minimum wage. They're talking about jobs and economic prosperity, and things are happening. And the other thing, too, is that, you know, Representative Nolan talked about common sense solutions. I hope that single-payer, government-run health care is not a common sense solution to what we need to do with our health care economy.
Thank you, Mr. Mills. Mr. Sandman, would you care to respond?
Well, once again, we got to have it affordable. I talked with some people here about 3-4 weeks ago, and just to make a living, this young man had to work 3 part-time jobs. That is not acceptable in a country like ours. He could not afford to have the insurance. So it needs to really be looked at, analyzed, taken apart, and make it affordable for everyone. No one here in this great state or in the United States should have to work 3 jobs at minimum wage and still suffer. No one. This is supposed to be the land of opportunity. I don't see no opportunity there at all.